In today's lecture, we are going to discuss the therapeutic nutrition. What is therapeutic nutrition? What is diet therapy? Purpose of diet therapy? Modified diets. What are modified diets? Food acceptance in illness. Various factors that leads to decrease the food intake. Diet therapy is concerned with recovery from illness and prevention of disease. And during illness or after any illness, the diet is modified. It depends upon severity of disease, any condition, patient response toward the food. Basically, the main purpose of the diet therapy is maintenance of health and prevention of disease. Therapeutic diets are planned to maintain or restore good nutrition status. Basically, therapeutic diet are modification of normal diet. Adding or removing any food depends upon patient condition, changing the nutrient, texture, flavor. And therapeutic diet are mostly prescribed by dietitian and doctors. Purpose of therapeutic diet or therapeutic nutrition. The main purpose of therapeutic diet is to maintain a good nutrition status, to correct the nutrition deficiencies, to maintain a healthy body weight. Modified diet. Diet modification depend upon the consistency, nutrient content, disease, or method of feeding. Inconsistency, clear liquid diet, full liquid diet, soft diet, blend diet, nutrient content, low sodium diet, low potassium diet, low protein diet, high fiber diet, low fiber diet. Disease, in case of constipation, we recommended high fiber diet, but in case of diarrhea, we recommended low fiber diet. In uh, hypertension, we recommended low sodium diet, and there are special method of feeding like NG feeding. Food acceptance in illness. During illness, various factors that lead to low intake of food. Intake of food is decreases during illness. The factors that lead the low food intake, in which decrease the appetite or some drugs and no physical activity. Some other factor that lead to low food intake during illness, in which room disturbance, a lot of questions that ask from patient related to their disease, or various movement of the various laboratories for investigation or the test, or the texture or taste of the food that provided by the hospitals. These are all other factors that lead to low food intake. The nutrient need and their use in the body may be affected by the illness. In case of diarrhea, the dehydration is most common issue that occur, or in every disease, the loss of the appetite, or during illness, loss of the appetite that may be lead to the nutrient deficiencies. And in case of fever, the metabolic stresses increases, so their requirement is also increases. If loss of 10% or more body weight, or restricted the oral intake of nutrient for 10 days or more, losses as result of nausea, vomiting, diarrhea, or other any surgery or GI issue, increase the metabolic needs in case of fever, any surgery, trauma, extensive burns, infection, chronic diseases, or impaired function of major organ system, use of drugs with anti-nutrient properties, that all the factors that may be leads towards the malnutrition. Iatrogenic malnutrition. The One type of the malnutrition that may be due to no food available or due to any disease, other condition. The iatrogenic malnutrition, nutrition malnutrition that occur when patient is hospitalized during this time period. The malnutrition is occur. We call iatrogenic malnutrition. During illness, the protein requirement also change. Loss of nitrogen is increased by stress. If the loss in urine are measured, then protein intake can be increased to make up for the loss. Strong flavor vegetables such as onions, radish, beans, cabbage, they are omitted from or removed from for specific time period from diet, and from patient to patient the acceptance of any food is also vary. Sometimes like onion, radish, these are accepted by one patient and not accepted by other patient for long period